the project director of the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. I'm also an associate professor in the Department of Health Policy and Management at the Rollins School of Public Health at Emory University. We're so excited to have you join us today for our session on classroom well-being information and strategies for educators, or Classroom Wise, an overview and implementation support planning for school mental health leaders. So, but before we get started, I just wanted to let you know that if you have any audio or technical issues during the session, the chat box is open for you to communicate with our team. And also, if you have a link to any resources that you would like to share with other attendees or with our team, please feel free to put those in the chat box as well. So today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short. We're located in Atlanta, Georgia, at the Emory University Rollins School of Public Health, and we're really proud to serve the 8 states in HHS Region 4 that you see pictured here. So our center includes faculty and staff that have expertise in public health programs, finance, policy, and health systems, and that gives us a unique lens through which we work to address the priorities of Region 4 and help disseminate evidence-based programs and practices. So moving on to a really quick disclaimer. This presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. The opinions expressed in this learning session do not reflect the official position of the Department of Health and Human Services or of SAMHSA. So moving right along, I'm so happy to introduce our speaker and expert today, Dr. Elizabeth Connors. She's an assistant professor at Yale University in the Division of Prevention and Community Research and at the Child Study Center. Dr. Connors is also a faculty member with the University of Maryland National Center for School Mental Health, where she is the Director of Quality Improvement and a developer of the SHAPE system. Dr. Connors received her PhD in clinical child and community psychology, and her research focuses on improving access to high-quality mental health promotion, prevention, and intervention services and supports for children and adolescents in underserved communities, especially at critical access points such as schools and community settings. So with that, I am just so thrilled to hand it over to Dr. Connors to tell you all about Classroom Wise, this wonderful new resource that we're so excited to share with you.
Thank you so much, Janet. I'm excited too, and I know that of our attendees here, some of you may have heard about Classroom Wise and have been anticipating it. We also know that many of you have never heard of this resource before, and so we thought that it would be a great idea just to kick off our summer series of office hours with a 101 and just kind of peeking behind the curtain to look in to see what is this resource, what could it potentially offer to your schools, and how might you think about getting started. So our learning objectives for today are just simply to increase understanding of Classroom-Wise development, structure, and content. We're also going to talk about some best practices to effectively support Classroom-Wise training completion and some practice implementation in local school systems. And our goal is always to really promote cross-state networking and shared learning about best practices in this work. So after I explain to you what Classroom Wise is and a little bit about what it has to offer, we have some discussion questions for you that we would like you to type in and share with us how this resource might align with other priorities in your buildings that you're connected to, or some ideas that you have about how to successfully support some uptake and implementation of this. So we do hope that, toward the end of the call here will actually be an interactive time for you all to really brainstorm with one another about applying this resource in your local schools. We do want to welcome all of you that are here. We want to do this by inviting you to type in the chat box your name, your organization, and your state. If you're here from a local district or school, please include that information. It's so helpful for us to see who's on today. We know that this session has actually been shared beyond the Southeast, so we probably also have some participants outside of the Southeast region. And so if that is you, we welcome you. And we're glad that you're here. So I see some outstanding introductions already coming in the chat box. Please keep that coming. Wonderful. And this is also just so helpful for us to see who is on today. Excellent. Okay, so let's dive right into ClassroomWise. This is a free 3-part training package designed for K through 12 educators. The 3 parts of the training package include the video library and resource collection, the online course, and the website. So this includes a 5-hour self-paced online course designed for educators and other school staff. And this is the online course actually has all these other companion materials that you can find on the website. This was developed by the Mental Health Technology Transfer Center Network in partnership with the National Center for School Mental Health at the University of Maryland. So before diving into some of these parts, we thought it would actually be worthwhile to go ahead and share with you the introduction video that you can access as well online and share with others. But part of our objective today is help you go ahead and do your homework on ClassroomWise during this time so that you're not leaving this session needing to go look more into it. You should feel sort of fully informed about what ClassroomWise is at the end of this hour. So I'm going to go ahead and play this video.
On behalf of the MHTTC Network and our partner, the National Center for School Mental Health at the University of Maryland School of Medicine, welcome to ClassroomWise. Funded by the Substance Abuse and Mental Health Services Administration, the MHTTC Network, Mental Health Technology Transfer Center Network, includes 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and our network coordinating office. We provide free training and technical assistance to help disseminate and implement evidence-based mental health prevention, treatment, and recovery practices.
Through our School Mental Health Initiative, we provide technical assistance on the implementation of school mental health services to states, tribes, districts, and schools. Please be sure to connect with your MHTTC regional or national focus area center to find out about training and technical assistance in your area.
Funded by the Health Resources and Services Administration, the National Center for School Mental Health focuses on advancing research, training, policy, and practice in school mental health. We encourage you to engage with our National Center to access resources and support as you build and enhance your school mental health system. We also invite you to access our free online portal, The SHAPE System, to assess and improve your multi-tiered system of mental health and well-being support for students and school staff.
ClassroomWise, Well-Being Information and Strategies for Educators, is a 3-part package that assists educators in supporting the mental health of students in the classroom. We started by talking to educators and mental health and education leaders across the country about what information and resources would be most helpful. We also conducted an environmental scan of educator mental health literacy training and resources.
We're bringing this to you because we know that educators are critical in supporting our students' well-being and overall mental health.
I think mental health and learning about mental health is crucial for every teacher, no matter what level you teach. We all deal with it.
Mental health training is so important for educators because they're in a position to know students really well. They know their students' strengths and their weaknesses. They have an understanding about what their needs are.
The course will go through not only how you can create safe and supportive classroom environments that promote an overall sense of well-being, but also some strategies that you can use to promote social emotional competencies in your students as well as in yourself, and also how you can support students who've experienced adversities or difficulties or who might be experiencing distress. and how you as a teacher can work as part of an overall team to get students the support that they need so that they can flourish in their school environment and in their learning.
The second part of the Classroom Wise package is a series of brief, high-impact videos with teachers and students talking about bringing mental health into the classroom and demonstrating how to engage students experiencing mental distress. The videos are in the course and available on our website.
The first mission that I have is to learn and get to know all of my students individually.
What makes me feel welcome in the classroom is that they give me a big warm smile. They ask me about my weekend.
Remember, we're talking about what we did this weekend. Josiah, I see you're really eager to share with us what you did this weekend. Can you tell us what happened?
I'm able to communicate to my students that I'm a safe person just by being emotionally available.
Teachers can make students feel more comfortable about approaching them with problems if they're more chill and open to listening to the kids.
I would want a teacher to comfort me and sit down and talk to me and give me some advice when I'm upset.
The third part of the Classroom Wise package is our website, www.classroomwise.org, where you'll find access to the online course, a video library, and all of the course resources, including tip sheets, guidelines, and links to key materials.
We understand the important role educators and school personnel play in supporting student mental health. Our goal is to equip you with strategies to promote student well-being and support students experiencing adversity, distress, and mental health challenges in the classroom. We hope you'll find this course impactful in your work.
So over the years, I feel like mental health has become more relevant in not just adults, but in students as well. And if a teacher is dealing with students, you have to teach the whole child.
So therefore, for me to take the certain classes that I need to take to make sure that I'm equipped to, deal with whatever the kids are feeling, kind of help them cope, I think it is so important that we continue to learn about mental health and how it could relate to our students.
I think it's incredibly important to train teachers in mental health because it's kind of the element that unlocks teaching because it's all built in relationships.
On behalf of the MHTTC Network and the National Center for School Mental Health, we hope you will find this online training course impactful in supporting the mental health of your students.
So I encourage you all, as we're going through this webinar, please go to classroomwise.org and feel free to be poking around and creating your login on there, which I'm going to walk you through in just a moment. I also encourage you, as Tara did in the chat, please feel free to use the chat box at any time for questions that come up. I hope that was just a helpful primer to kind of let you know how Classroom Wise was developed and what the goals of it are. And again, this is an intro video that's right on the website, so you can share this with your colleagues and don't have to be in the position of retelling what Classroom Wise is about. So please feel free to use this introductory video as you're sharing this resource with your colleagues and kind of evaluating its likelihood of adoption in your schools. Okay, so we wanted to be really concrete with you all about how do you get into the Classroom Wise course itself. So we are including these screenshots so that you can really be walked through it. When you go to classroomwise.org, you will see a purple button in the upper right-hand corner that says Launch Course. It's very intuitive that you would click that to launch the course. And please note that then it will take you to a separate website, which is called Health eKnowledge. And this is a website that houses a number of professional development opportunities and online modules funded by the Mental Health Technology Transfer Center Network. So just know that once you go into Classroom Wise, the online course portion, you will be taken to this Health eKnowledge site. From there, you'll see Classroom Wise, it's usually listed as the middle course right now, and you can click on View Description and Enroll. From there, you'll see a pop-up and you simply click register now and begin course. And if you don't already have a Healthy Knowledge account, it will prompt you to create an account with a username and password so that when you come back the next time, you can just log in with your credentials. So this is what the landing page looks like once you're logged in on the Healthy Knowledge site to the ClassroomWise course. So this is the site where you find the course itself. So please note that there's information here that will tell you a little bit about how the course works. The course obviously has narration, so make sure your speakers are on. You can control the volume or add closed captions. There are accessible PDF transcripts on each module's homepage. And I mention that because it can be particularly useful to look at what is included in the modules, particularly if you're like in a state or district leadership position and you want to see what those modules include, maybe without going through and taking the module yourself. There are also quizzes that are included for completing the online learning, each online learning module. And so you have to receive a passing score of 80% to advance to the next module. There is a certificate of completion that's offered. I know we already got some questions about that. And CEUs, oh, look, I see Joe's holding up his certificate of completion. Wow, way to go. You are ahead of the game. So yes, you can get a certificate of completion just like Joe's and your 5 contact hours when you've completed the course. I do see that Tracy says that her access is denied. I haven't heard of that error message quite yet, but maybe someone on our team can back channel chat you and see if we have any sense of what might be happening there. It is a free course, so you should be able to just create login credentials. One thing you might want to try is using another browser. I'm not sure what browser you're on. I was accessing it on Chrome and I didn't have any issues, but sometimes that can be a web browser issue. So here's a little bit about the course description, and we're going to go into each of these modules with a little bit of detail. I also welcome folks to join us on video. It's so great to see faces, by the way. So for those of you who can enable your video and join us, please continue to do that. So there are 6 modules here. Creating safe and supportive classrooms is module 1. Teaching mental health literacy and reducing stigma is module 2. Module 3 is all about social emotional learning. Module 4 includes understanding and supporting students experiencing adversity and distress. Module 5 covers the impact of trauma and adversity on learning and behavior. And Module 6 includes classroom strategies to support students experiencing distress. We're going to go through what each of those include in a moment. This is a screenshot of the quiz that you'll be asked to take at the end of each module. And this is a screenshot of the transcript that I mentioned. So again, you can pull the transcript in PDF version from any of the modules at any time without taking the module. So if you want like a peek inside what's included, what the videos are, what the resources are, it's all right there for you. So we'll come back to the course in a minute, but before we do that, I want to highlight these other 2 elements of the ClassroomWise package, which are absolutely outstanding. These 2 elements you'll find directly on classroomwise.org. So when you're launching the actual course, it takes you to Healthy Knowledge for the course, but the video library and the resource collection is housed on classroomwise.org. The video library, as they mentioned in the introductory video, includes all of the videos that also appear in the course. The videos, in my opinion, are absolutely outstanding. They are done in the words of real students, real educators doing the work and sharing their perspectives and experiences in a way that is impactful, but also reflective of high quality content and best practices. So I encourage you to just browse the browse the video library. Most of these clips are, a minute or 2 minutes. They're really, really brief. So if you're wanting to kind of get a peek inside what these videos look like, I highly encourage it. Also, if you're trying to encourage your colleagues to understand about the impact of this resource, you may want to share with them some of these great videos. There's also a resource collection on here on classroomwise.org. So all of the resources that are included for each of the modules can be easily accessed at the resource collection. You can filter by the module that you're looking for, and it is very, very easy to navigate. You can directly download resources and check those out. So whether you've completed the modules or not, you can access this resource collection and video library at any time. It's also a really nice reference for after modules have been completed. You want to put your finger on something that you remembered that you really liked, you can go back to them here. Okay, so let's dive a little deeper into what is the actual content inside ClassroomWise, because I think this is particularly relevant when you think about alignment of this resource with other things that you have going on in your schools. So every school and district probably has some experience doing mental health education or training for teachers, right? In all kinds of different ways. And so by looking into what the modules actually include, I think it can help you think through other professional developments maybe that you have planned for the upcoming year or other initiatives, and think about how this might align. So in general, the first 3 modules really focus on promoting mental health and well-being of students. The modules 4, 5, and 6 look at understanding and supporting students who are experiencing adversity and distress. So I don't want to draw like too many buckets or lines here, but in some ways you can think about module 1, 2, and 3 as your universal mental health promotion sort of tier 1 strategies. And modules 4, 5, and 6 are helpful for students who are already experiencing some level of distress or adversity or exposure to potentially traumatic experiences. So in module 1, it goes through the different components necessary to create safe and supportive classrooms. It includes guidance on helping students feel engaged in the classroom community. There are some really nice videos from students themselves talking about that and what their recommendations are for teachers. There's guidance on helping students feel just safe in the classroom, both physically and emotionally, and things that are very practical strategies that teachers can do to create a safe and supportive physical classroom environment. I do want to pause for a moment here. I see there's some great questions coming in the chat. So Catherine has said, if I'd like to have a meeting with our superintendents or educators about this course, are there talking points or something I could use? That's a great question, Catherine. And I think that's something for our team to think through, and we can connect with you. I know we have your email address, and see what else you might use. I would start with the ClassroomWise website. I mean, if I were in your position, I would probably show them the intro video, and show them what's included in the 6 modules. And I would pick 1 or 2 of the videos from the video library that you think are, particularly aligned with kind of their language and thinking of what they're looking for teachers to be equipped with, and show those. Sometimes videos can be the most impactful way to kind of get across what it is that the content includes. But if there are other talking points that we need to get you, or a bulleted list or something, that's something we can work on. And I should mention that, today's webinar is the first of a 6-part series that we're planning for the entire summer, where we're actually hoping to get questions like this from the field to really understand what is needed right now to support ClassroomWise understanding, adoption, and implementation, so that as technical assistance providers and your supports, we can figure out what is needed additionally to support your use of this. So all throughout our office hours this summer, we're going to be sharing different resources and materials and ideas that people are requesting and people are sharing as it pertains to ClassroomWise implementation. There's another question, a couple of questions that have come in around Rebecca's question. She's a project coordinator on school-based initiatives and working very closely with schools and districts, although she's not in a school herself. And I do think, Rebecca, that in your role, it would be very appropriate for you to support schools and districts in this work. And I also think that as a support partner if you have the time to take the modules yourself. That's really going to be the best way for you to get an inside look at what they include, to be kind of in that consultation position. I think it would absolutely be appropriate. There also may be, you know, mental health providers in the schools, for example, or different types of professionals who are champions of this work, who maybe know about the content included in these modules by virtue of their training or experience, but to really watch the modules and become immersed in the content is really going to help you communicate to people that you're supporting about the value of this resource and how it may be helpful for your teachers. Oh, good. Thanks. Jessica put in a classroom-wise overview 2-pager. Thank you so much. Jessica is here from the Network Coordinating Office with the MHTTC, so we're so glad to have you on today. That is beautiful. Okay, so Module 2 goes over how to educate students about mental health, how to integrate mental health literacy into instruction, and how to address mental health stigma in the classroom. So I know recently we had a webinar about mental health literacy and awareness and stigma reduction with a lot of best practices that we included. So that's exactly the same kind of content that you would find here in Module 2. In Module 3, there's a focus on social emotional learning, competencies, and well-being. So there's an introduction to SEL with information about how to integrate SEL competencies into instruction, and then very practical strategies for teaching students SEL skills. So you can see shown here on the slide, there's a core lesson example of self-awareness, and it's got some information there about what the teacher might say to introduce this concept of self-awareness and ask students to provide feedback on what that's like for them. And you can see some examples here. So as you've probably picked up on by now, there's not a specific proprietary sort of package or, you know, comprehensive program that necessarily is represented in Classroom-Wise. These are principles and practices that are aligned with the evidence base and best practices. And this is a free resource so that it introduces competencies and skills that teachers can use, and it's fairly agnostic to any specific SEL package or program or other, you know, comprehensive package you might be implementing. Now, you may have some very strong SEL practices or programs in your school buildings, and I think that that would be a wonderful alignment to this Module 3. I would anticipate that teachers taking Module 3, if you've already got SEL going on in your building, they would see that alignment and see that those skills are very complementary, if not the same. Okay, so Module 4, again, now we're moving into the portion of the modules that are really addressing supporting students who are already experiencing distress or adversity. So Module 4 is exactly about that. It overviews typical child and adolescent development, as well as strategies for promoting healthy child and adolescent development, how to recognize signs and symptoms of student distress, and then how to link students with potential mental health concerns and their families to support that they may need. Module 5 goes through the impact of trauma and adversity on learning and behavior. So this overviews the ACEs, which some of you may be familiar with already, adverse childhood experiences, as well as the impact of trauma and ACEs on learning and overall functioning, both in terms of kind of school performance, academic performance, but also the impact that it has on our brain development. There are also strategies for integrating trauma-sensitive teaching practices in the classroom. And then Module 6 really hones in on those practical classroom strategies that teachers can use. So there is some portion of the module that talks about identifying factors that contribute to student behaviors to really sort of broaden the lens that teachers have on why behaviors may be occurring, what could be potentially underlying that, as well as practices for co-regulation and self-regulation of skills. And this refers, of course, to kind of the teacher's own regulation of themselves in terms of their emotions and behaviors when responding to students. We know, of course, the research shows that when teachers and other adults in the school building are able to regulate their own emotions and behaviors in the moment, can actually be very supportive to students who are learning and those same skills, right? Because there's so much teaching that goes on through the modeling of that, and that's what co-regulation refers to. It also includes classroom strategies to support students experiencing distress. Okay, and before we go into our discussion of sort of alignment here, I want to respond to Bob's question in the chat. I'm glad that you like the resource, Bob, and that you're going to encourage folks to use it. There is an elevator talk, of course, that Rebecca mentioned wanting, and you're wondering if there's any mapping of this material or evidence-based approaches in the 6 modules. So I'm wondering, and Bob, I don't know if you have audio, but I'd welcome you to unmute and share aloud. Are you thinking about mapping of this material onto other types of materials that are similar, or you're just looking for a map?
Yeah, no, you'd mentioned ACEs after I texted that. So I just wanted to make sure that there's connections to this material to other materials that we all may have been using in our already in our schools. That's all. Make sure the connections are there to other evidence-based materials. So
yeah,
we're not trying to draw the connections, they become evident.
Absolutely, absolutely. No, I think it's a really good point, Bob. And I think that as, and I know like you have a really high level of expertise with all of these topics. And I think in some of the language that's used throughout Classroom-Wise actually really facilitates that alignment and seeing what it is aligned to, right? So some of you, for example, that have trauma sensitive or trauma responsive approaches in your buildings, right? You're already seeing some language in Classroom-Wise here that aligns with those same principles and practices. So that's another, type of language that's used often in schools, and in some schools that's a really important priority. So that's an example of another concept and set of sort of evidence-informed frameworks that are highly aligned with Classroom-Wise, right? So
exactly. Yeah, language is critical. We're using the same language. So that's what I was looking for. So thank you for that answer. Perfect.
Absolutely. So we're going to actually brainstorm a little bit on this right now, because I think this is exactly the thought process that all leaders in your positions are going to have to go through, right? Because there's obviously always concern when there's a new resource that's coming up for schools about, how is this going to align with what we're already doing? We can't be adding more to the plate, right? So bringing in something brand new that feels additional is going to be met with resistance, especially in the context of the current climate where people are already so overwhelmed. They have numerous additional duties. And we're talking about reopening schools in the fall, which is really going to be a big feat. So I think there has to be really careful thought to how Classroom-Wise will align with your current initiatives, and as well as may actually support and check some boxes, so to speak, of initiatives and priorities that you already have. So what I'd love to do now actually is to invite some of your thoughts on this. I mentioned trauma sensitive, trauma responsive schools as an example of another existing priority that Classroom-Wise might particularly align with. But I'm curious how Classroom-Wise might align with other types of priorities or existing initiatives in your school. And so to do this, we're going to share in a couple different ways. You've got some choices. You can, of course, type into the chat as always and let us know in the chat. But you could also, can you all see this electronic board here that I'm showing? Yes? Okay. So this is called a Jamboard. I don't know if you guys have used it. It's a really neat, just like virtual sticky note brainstorming board. And so if you go right to the link that your Janice put in the chat, you can add a sticky note with your response, and it's just an anonymous way for you to share your thoughts. You're also welcome to use the chat if you'd prefer to do that. I'm keeping an eye on both, but whether you use the Jamboard or the chat, feel free to just share your thoughts. How does Classroom-Wise align with priorities or existing initiatives in your school? And in this, you're creating your own talking points, right? So this is what you will need to message to your colleagues. If you think that this resource is potentially a good idea, these are your talking points. Perfect. I love Joe's response. He says, we're focusing on continuing to address the needs of the whole child to increase student wellness and decrease the achievement gap. That is an excellent and factual point, and I think would be a very good way to sort of message the value of Classroom Wise. If focusing on the needs of the whole child are particularly important in your schools, this will absolutely help with that. I see some folks are starting to add to the Jamboard. During the past year, we piloted 2 SEL curriculums in some of our districts, and Classroom Wise is in line with SEL. Absolutely. So let's say you've got some strong SEL going on or started, you can see how, one of the 6 Classroom Wise modules is on SEL, but it really brings to bear a number of other really important content areas for teachers to be aware of. So really could complement your strong SEL focus by bringing in some training on the other elements, just sort of general mental health awareness and literacy, how to respond to students experiencing distress and adversity. So those other 5 modules that may be a little bit beyond what your current SEL programs or practices offer. So it could be very complementary in that way. School-based diversion and reduction of exclusionary discipline, strengthening staff and child relationships to keep students connected to the school, community, and learning environment. Absolutely. So actually the first module is very much focused on strengthening staff and child relationships. That is really a core hallmark of module 1 and also shows up across other modules. So if that focus on strengthening relationships is really present in your buildings, that's an important talking point. And we know that if you're trying to reduce exclusionary discipline or crisis response needs or tier 2 and tier 3 services by providing a strong foundation of wellness and resilience and connection for all students, then a training like Classroom Wise is really going to meet that need. It's absolutely aligned with the tier 1. Yes, for sure. Yeah, and so I know that in the state of Florida, they were early on with a mandate about mental health training for teachers. And I know initially in the state of Florida that some locales, I believe, were able to choose their mental health training. It sounds like more recently, some things have changed. Maybe there's a requirement to take youth mental health first aid, which I know is at cost, and I believe a full day training. So I think if you've got something like that that's already being mandated, we would love to talk with you about how Classroom Wise may complement what you have going on already. If you're doing youth mental health first aid, or maybe some portions of it could complement that work. Yes.
May I ask a question?
Please.
Hi, this is Nancy Rees from Palm Beach County, Florida. So I think the course you've put together is amazing with all the resources. I've completed 2 of the modules, and I just want to compliment you on the work. My only concern with it is in the videos, the way the adults give feedback. They use that, they give feedback in ways we encourage our staff not to give feedback. They say, I like the way you. And we don't want our students to focus on pleasing the adults. We want to encourage them to continue to learn and grow. So it's an intrinsic motivation. Would there be any possibility of replacing some of those videos with where that feedback isn't, I like the way you?
That's such a good question, Nancy, and I appreciate it. And I think these are the questions and the points of feedback that we're looking for as people dive in. If you see things that are inconsistent with how you would, like to communicate these things to your teachers, that's something we need to know so that we can relay to the development team and figure that out. I know Jessica Gonzalez is on the line. I don't want to put her on the spot too much, but Jessica, I'm curious if you have any additional thoughts to share on that.
Yeah, hi everyone, and hi Elizabeth. I'm so happy that I joined this session. Again, I'm the school mental health coordinator from the MHTTC Network Coordinating Office and was very involved in the development of this 3-part training package. And I think, Nancy, thank you so much for your comments. Really appreciate learning from everyone in the field. And I know that it's going to vary, right, across regions and across schools and districts, the way that educators are trained and the terminology and the language that we use with students. And so I think that's one of the hard points, because I think when we were speaking with the teachers that we utilized for these videos that we worked with, obviously in their schools, they're using that language. And I don't think that we had like any red flags for that. And so when you mention, Nancy, what you all are doing in your schools, and that totally makes sense about not wanting to use language that's kind of like telling the student that, like pleasing the teacher. So I totally get that. And I feel like hopefully as people start to take the course and start to try to implement the strategies that are mentioned in the course, we start to get some feedback like this so that we can go back and revisit some of these pieces of the training package and see if there are ways that we can go back and edit or maybe recreate some of these videos. But I think, it's going to be an evolving thing. It's not like we put out this training package and we're like, great, it's perfect. I think we're thinking that over time, and as we hopefully continue to get funding for our school mental health initiative with the MHTTC network, we'll be able to continue working with Elizabeth and her team at the National Center for School Mental Health and going back and making edits to some of those things where people are kind of, calling out like, hey, maybe this could be improved in this way. And so we really appreciate that, Nancy. And I know that the Southeast team is making note of some of the feedback that we're getting. I think Bob also mentioned a great point about, I think, being very specific about the evidence-based content and how it relates to some of the other evidence-based approaches that are being used already by educators and schools. And so I think, again, like Elizabeth said, all of this feedback is great. Please keep it coming. Please let us know why you think something should be changed or something should go back and be revisited. And I know that over time, we'll continue to make every effort possible to go back and make those changes.
Thanks, Jessica. I'm so glad you're on today. And I will say that, with all the resources that have been supported by the MHTTC, it's been my experience that, we put something out for the first time and then we hear from the field and we go back and make revisions as needed in a way that makes sense. And when that makes sense, that we've received feedback. I know with the best practice guidance modules for comprehensive school mental health, that was the case. Several months later, we went back and made some needed changes based on feedback. So I appreciate the MHTTC for its responsiveness to the field in that way. So we really are open to your feedback as you dive into these modules. Share with us your thoughts and what your needs are for improving upon this and making this really compatible with your values and best practices locally. Okay, great. So let's march on. I wanted to touch on a couple other points, which I think actually may be already noticed or mentioned in the chat, which is the value added of ClassroomWise as you're starting to think about how ClassroomWise sort of stacks up to other things you may have access to. I see Youth Mental Health First Aid mentioned in the chat, and someone else had mentioned that as well in the Jamboard, right? So there are other things that are very similar, like Youth Mental Health First Aid, that we'll have to think about, as you're weighing the pros and cons. Do we introduce both and we just offer them at different times? Are there elements of this that are complementary? Or are they duplicative in a way that it doesn't make sense to onboard, for example, ClassroomWise, if you have access to something else? The other piece, not to jump around too much, but I do want to address comments as they arise in the chat. There were a couple comments around focusing on the needs of teachers to support their own mental health. And when I was talking about sort of self-regulation and co-regulation, which I believe is included in Module 5, there is some content that I believe will touch on sort of staff well-being as well. But if that's an area of particular focus for you, then you may, I would encourage you to look at the transcripts, look at the videos, see if that content is really covered to the extent that you're really looking for. And then you can think about if there's something else that you would want to add that's more about teacher well-being. By and large, this course is focused on student well-being, but there are some elements that touch on staff well-being as well. Okay, so classroom wise. So with any new resource package, we know that, you know, many of you have deep experience on this call with how to introduce and implement new resources or initiatives in schools. And that's why we just spent a moment talking about and brainstorming alignment, because you are already trying to figure out how to get your talking points together. And so Classroom Wise was actually developed to eliminate a number of barriers to other mental health trainings for teachers that schools face, because there's already a lot out there in the marketplace, so to speak, on these topics. So here are some areas that Classroom Wise was designed to really have value added in this field where there already exist other mental health trainings. And the first is around the free cost. So we know that many mental health literacy trainings are costly. Mental health knowledge should be accessible to everybody regardless of cost. So this is one barrier that Classroom Wise is attempting to address, as well as pace. So we know everyone learns differently, and self-paced means that there's more accessible learning and retention for diverse audiences. The duration is 6 hours. The course is efficiently packed with a lot of essential information, and it averages about 6 hours per trainee. So this, you know, is something that you can keep in mind when you're thinking about how much time may need to be set aside for this. The timing of this is not something that you necessarily have to schedule a person to come and do in person, where, or even virtually, where everyone has to gather at one time. The course is available 24/7, 365 days a year. So it's not like a standalone training where there's only a certain point in time to access it. We know educators have very, very full plates, and people are starting to get real creative about their PD time and PD calendars and ways to offer teachers more flexible ways to get their mental health and other training done throughout the school year. So this is another barrier that Classroom Wise is designed to tackle, as well as engagement. You know, as I know, I was really talking up the videos, and they truly are great. And this is designed to be an engaging and interactive and accessible type of way to do training. And we're going to go deeper into implementation planning considerations over the course of the summer. And this is really what the Office Hours series is designed to do. But we've already gotten questions about, you know, there's so many other systems floating around, and schools sometimes can tend to do what is, you know, what is nearby them or what is trendy. And so there's a lot of curiosity around how do we sort of implement this in a way that makes sense in our schools. And so you might want to consider implementation from a variety of lenses. First, there's kind of that uptake or initial adoption of actually viewing the modules, and sort of how is that going to get done, so to speak, in terms of, are these suggested for your teachers? Are these required for your teachers? Are we doing all the modules together, etc.? And then thinking about supported application in an ongoing way. And this is something that we're hoping to kind of learn more from the field about as this school year unfolds. You know, with any new package that you onboard, we know that actual application of these strategies are more effective in reality when there's some kind of supported way to apply them. So we're curious to hear from you over the summer. What are your thoughts on this? Are there team-based discussion opportunities that you may want to build in, like following a module viewing? You know, there could be a team-based discussion at the school level. Any coaching or consultation supports you may want to add in. Maybe you've got a really strong school mental health team that can be available to follow up with teachers about any of the content in these modules. And there are actually natural mechanisms for peer support and shared learning in schools, like grade level meetings and professional learning communities. So I encourage you to think through how in application you could extend what's available on the Classroom Wise site and in these online modules to really just facilitate application and conversation about this content in your buildings. We'll also be thinking this summer about multi-level implementation roles and responsibilities. So implementation of anything involves a real multi-level process. The administrators, I think we have many leaders and administrators on with us today. And so you're in the position of communicating about alignment with strategic priorities and student needs and clearly explaining the purpose of ClassroomWise and how it will be used. But you've also got school mental health professionals who may be involved in supporting the application or discussion of this content, as well as the educators who are so critical in providing feedback to their teams, their administrators about this course and about these materials, so that again, we're really looking to get feedback from the field on this resource and have that true stakeholder implementation loop. So in the interest of time, I'm going to throw this question out there, and I invite questions in the chat. This could also be a thought question for you. This is the piece that we're really going to unpack in future sessions. Based on your experience of prior implementation efforts in your schools, you know what's gone well and you know what's not gone so well, right? And there are many different types of trainings and initiatives that come and go from schools. So based on your experiences, what do you foresee as a successful approach to ClassroomWise rollout and implementation? What do you know from past experiences is going to be unsuccessful way to roll this out? And I think there are many elements, everything starting from the communication and the messaging, as well as how it's required, when it's required, ongoing support, that we can think through together to make sure that this is a successful implementation experience for those of you who are really looking to adopt ClassroomWise and use it this year. So we do invite additional questions and answers throughout. I know that we have, what I'm going to do is go ahead and show you, I've got a next couple slides to tell you about office hours, but I invite any additional questions that have not come up yet. There is one question that I thought was particularly pertinent that came through when you all register for this event. You enter in questions. That's very helpful for us to see so that we can prepare this content. One of the questions came through was from a participant working with rural Alaskan districts and schools, and they were very interested in culturally responsive mental health approaches and wondering how ClassroomWise and other mental health supports in schools can be attuned to those. So I did want to speak to sort of cultural responsiveness and equity for a moment here. We did intentionally integrate cultural responsiveness and equity into the modules. So it is included at sort of a basic level into all of the modules. For example, the modules do reference use references that include inclusive language, and also having conversations about differences in schools that teachers can facilitate. There's also a strong focus on building relationships that's really threaded throughout. You should also know that there is a companion cultural responsiveness and equity module that's a kind of a companion to ClassroomWise that's currently under development at the National Center for School Mental Health. That's funded in partnership with the Central East MHTTC region. And that companion module will more explicitly address cultural inclusiveness and equity in the classroom. We're hoping that's going to launch sometime late this summer. So there are definitely some elements included in this 6-module course, and we also hope to release a companion course to go deeper into those elements for those of you that are very interested in that. This is what our lineup looks like for the rest of the summer. We hope you join us for any or all of these. Please don't feel like you have to come to them in succession or drop into the ones that work for you. What we're planning on doing is doing a little bit of a deeper dive into 1 or 2 modules in the upcoming session. So if there's certain modules that you're interested in, please put those dates on your calendar. We are also going to integrate into all of these office hours implementation supports like the 2-pagers that Jessica put in. If people want to talk about talking points, other questions that come up, we will always earmark a section, of these office hours specifically for general Q&A, general implementation support, as well as kind of talking through a deep dive of 1 or 2 modules. And on August 10th, we have a 90-minute session scheduled. We are planning to share all of the implementation planning tools that we've learned about and developed. And we're really going to do kind of a summary of shared learning in terms of what we've heard from the field over the course of the summer. So we hope that you join us and share this with your colleagues. We hope to see folks join us this summer for these office hours about ClassroomWise. Okay, so with that, I'm going to hand it over to Tara to tell us a little bit about the evaluation today. And if folks have lingering questions, please feel free to type them in the chat and I'm happy to answer them. I see Jessica and some others from our team are answering questions in the chat as well. So if you have lingering questions that you haven't yet had answered, please type them in the chat. And with that, thank you so much. And Tara, take it away.
Thank you so much, Elizabeth, and thank you, Jessica, for helping us answer questions. And thank you all for participating and showing up and asking questions. So we are required by our funders, SAMHSA, to gather your feedback on our events. And I just put that link in the chat. Let me put it in again. And if you click on that link, it's a very brief survey. It'll just take a few minutes and we'd really appreciate it if you filled it out. And after that, it'll lead you to another quick survey. That's our internal survey. And we would appreciate it if you filled that out as well.
Yes, sorry, there was a request to see the dates, so I took us back there for a moment.
Okay, yeah, you can keep it on the dates and I'll put it in the chat box a few more.
Okay, great.
Okay. Thanks, everyone.